If your dog is bruised after CCL surgery, any of them, bruising is a normal thing. Expect it. The bruising sometimes gets a little worse as the days progress. So day number 1, you might think, oh my gosh, hardly anything. And then as the days go on, the bruising gets worse and worse in color. It might start out kind of pinkish red, and then it goes to dark red, almost purple. Swelling is normal after CCL surgery. The swelling will be, of course, around the incision, around the dog's knee, and farther down into their hock, which is around their ankle. When a vet does a really good job on their TPLOs and they're confident in the structural repair, they don't care if your dog uses their leg. If your dog is willing to put a little bit of pressure and they're willing to toe touch on that post-op leg, it's totally okay. Now, are they allowed to lunge, jump, run, stuff like that? No. Should you be playing tug with them where they're putting pressure on their back legs? No, you shouldn't do that. But can they use their leg in a slow and controlled way? Absolutely. If your dog is still limping after their TPLO, depending upon the time frame, it might be totally normal. So I think what happens is, and this happened to me, after my dog's first TPLO, I had no prior experience with CCL surgery. It was week 1 and he was still limping, and I thought, okay, well, that's normal. Week 2, he was still limping, not really using his leg that much. Week 3, week 4, week 5, he just wasn't using his leg as fast as some of the other dogs that I read about online. I was using the other dogs to measure my own dog's progress. I didn't know I shouldn't have done that because every dog heals in their own way, at their own time, right? Then other things play a role too, like how old is the dog? Do they have any underlying medical conditions and things like that? Expect that your dog is going to have some trouble changing from one position to the next. If your dog is having a hard time getting up from a lying down position, then you might need to get behind them and help them up. As you lift them, you say up, 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 and help them up. Keep encouraging them. Come on, you can do it, you can do it. The encouragement will be good for you too, because lifting a dog right after surgery for the first time can be quite stressful and scary. Just be ready for that. You can do it. If you're taking your dog outside and you've got a couple of steps going down into your yard, that's where you would use a sling. If they're bearing weight and they're able to 3-leg it even, you can let them go outside without a sling as long as they're on their leash. Always use the leash when you're taking your post-op dog outside, because it puts you in control of where they go and how fast they get there. Don't think, oh, well, I trust my dog. Because what happens is sometimes dogs see other dogs, a squirrel, a person they love, or an Amazon truck, and then they go charging after it, despite your calling them to come back. Being leashed is super important after CCL surgery. Usually going upstairs is slower for dogs. It's when they go down that they're kind of just like rumbling down the steps, and then 4 steps left, sometimes they just jump to the floor, right? So that's where you've got to be super careful. If you have an upstairs and downstairs, block the steps with a baby gate or something so your dog can't run up and down. Bone healing starts right after surgery. The body's trying very hard to heal everything, but you can't really notice the bone healing until about 6 to 8 weeks post-op. You've got to be super careful the first few weeks after surgery, because the only thing that is holding your dog's leg together are the plate and the screws. If your dog is jumping, if you have an oops moment and your dog goes racing through the yard because the door doesn't latch or you didn't take them out with their leash and something happens, the implants can actually fail, meaning the screws can snap, the plate can break or bend, so you don't want that. When we think about when they first come home, the first things you'll notice as far as recovery time is the incision is going to heal up. At about 10 to 12 days, sutures or staples will be removed. Some dogs don't have to go for that if they use dissolving sutures. If your dog is lying on the TPLO leg, don't worry, you don't have to switch them around or move them. It's totally okay. Expect slower than normal walking. Just being kind of restless because they're so bored. That's normal. You can give them puzzle games and things like that. You can sit in the recovery area if it's big enough. You can hang out with them in there. They like that. Let's say you gave the pain medication at 12 o'clock and then you're due to give it again in however many more hours, and you notice, ooh, they're starting to pant, they're starting to look restless. It might just be because it's almost time for their next dosage of pain medication. And you could be strategic when you give the pain medication, maybe like a half hour or 40 minutes after that might be a great time to try taking them outside when that pain medication is actually kicked in and working. If you're wondering if your dog's pain meds are working after TPLO surgery or any of the CCL surgeries, here are some things to look out for. Panting, even though they're just lying there and doing nothing. They're not exerting, so why are they panting? That's a sign of pain. If they're snappy, biting, growling at you, they might be in pain. Here's a warning. Even the sweetest dog, when they're sore and there's another pet around, or a child around, or even you, and they've never shown signs of aggression before, that dog might become aggressive if they're painful. And of course they're painful after orthopedic surgery. It's a major surgery. So be ready for that. Let your dog have their own space as they heal. If you have another pet, and especially if you have small children who are impulsive and they just don't know what's going on, let your dog have their own space so they can feel safe as they heal. If your dog is lying there and they're whimpering a lot, it could just be because they're bored or anxious. It might not be because they're in pain. Here's what I want you to do. Take note of when you gave the pain medication, okay? Let's say you gave it at 12 and it's almost time for the next dosage, and here's where you're starting to see them acting up a little bit. They seem unsettled, they're panting, they're a little bit quivery or shaky, they're trembling. It might be time for the next pain medication dosage. If you're concerned that pain control is not good enough, then of course, call the veterinarian. Whatever you do, don't go online and say, can I give my dog extra pain medication? Can I double up on the dosage? Don't do that without your vet's okay. Don't trust any dog owner who says, oh, you can give them extra. My dog weighed the same as yours and they were on double the dosage. Don't do it. I am telling you, I'm begging you actually, because every dog is different. Your dog might be on other medications. They might have an underlying medical condition that you can't give extra pain meds, okay? So always, the prescribing doctor is the one who should be making any alteration to timing or dosage for any medication your dog is taking. So here's when to be concerned. If your dog has been progressing really well after their CCL surgery and then they stop, like they're starting to limp again, that's when we start thinking, might there be an infection? Or could their meniscus be torn? Sometimes a dog goes into CCL surgery and their meniscus is totally healthy, and then during recovery, it tears. Sometimes people notice their knee is clicking a little bit, and if that happens, reach out to your vet team as soon as possible, and they'll help you figure out what to do next, if anything. Bone healing starts to become evident on x-rays, and that's why they do the follow-up x-rays. You'll see where that curved cut was. If your dog had TPLO, it's starting to fill in with new bone growth. It's pretty cool to see. After that point, your dog is getting stronger. Their skinny chicken leg is starting to get a little bit more muscular. If you're wondering about TPLO recovery time and how long it takes for the dog to get back to normal, it's somewhere around 12 weeks, but that doesn't mean they're back to 100% at 12 weeks. Of course, we're all dying for that moment where our vet says, your dog's fully healed. And what do? We want to go outside and throw the ball. And that's exactly what I did. I went to my backyard, we celebrated with some running around and playing fetch, which everyone's dog loves, right? Threw the ball over and over and over, and guess what? He started limping again. That night, limping. The next morning, and for days after, more limping. Here's what I learned. I reintroduced activities a little bit at a time where he wasn't zigzagging around while he was running, no jumping and no darting. He did so much better. My dog had his TPLO surgeries in 2018. Even now, when I go outside to play with him, I'll take his ball or toy, place it in the yard, and give him a command to go run and get it. So he's running in straight lines every time. No darting, no wiping out, no jumping, because if I let him do those things, he most certainly will limp. If you're wondering how long your dog will be in pain after TPLO surgery, that's a really good question. And I think it depends on the surgical skill and expertise of your vet. It depends on if they had arthroscopy versus arthrotomy to check their meniscus. It depends on your dog's physical health, How long did you wait before they had their CCL surgery? Was there a lot of muscle atrophy? Did they have a lot of arthritis? Let's say you caught the CCL tear early on and your dog got their surgery within months of tearing their CCL. And you had a very skilled surgeon. Your dog healed without any complications, no infection or anything like that. You're going to notice that week by week, they're a little less painful, a little less painful. And as long as you're not having oops moments, little setbacks that you think, oh, well, it's no big deal, they lunged after a squirrel, or they darted out the door even though I had their leash on, they yanked me, or they ran upstairs, they busted out of their crate, they jumped over the couch. They jumped out of their recovery area, the little exercise pen that you had them in. All those little oops moments can add up and prolong the time, the amount of time that your dog is feeling pain. Now you're getting near week 12. You're almost at the finish line. At this point you think, well, they're fully healed. We can go out and play fetch or whatever. Just remember, it takes time for muscles to rebuild. So slow and steady reintroduction of normal activities at that 10 to 12 week point. If your vet says your dog is fully healed, it doesn't mean go for a long hike up some mountain. It doesn't mean go for a run or play a crazy game of fetch or go to the dog park. Your dog still has weakness in the legs. So slow and steady how you reintroduce normal activity.